Hey guys, I just want to take a moment to discuss with you sciatica, exactly what is it and what's causing it. So sciatica is essentially compression of the sciatic nerve, which starts in our lower back, transversely through our glutes, down the back of our legs, splits of our knee and goes into our feet and our toes. It's a common symptom we treat in the office, and unfortunately many Americans suffer with it. Classic symptoms are pain that are in your glutes or pain that kind of travels down the back of your leg. Can even get into your feet and your toes. Progressions of those symptoms are usually sharp, starts as a sharp stabbing pain, but then as we progress through we start seeing some numbness and tingling, and the worst case we see is loss of extremity function, particularly motor control, so we start getting that drop foot. Now we're all products of our environment, right? And unfortunately the average American today has to sit for 9+ hours a day. So what does that involve? It usually involves a commute in, or you're driving 30 to 40 minutes, you get to work, you sit for an hour, you do the same commute home, you get home, you're exhausted, you sit for a living. Essentially, so this sedentary lifestyle pulls our spine out of alignment and creates massive amounts of stress on the spine, the joints, the tissue and the discs. And I just want to go over how that essentially is causing your low back pain. So when you look at a healthy spine, it's within alignment and has good posture, from the side you should see a nice even curve that measures around 40 degrees. We have curves in our spine to absorb and carry the weight of our body, gravity down and floor up. However, all that sitting, essentially everything in front of us, we just have that centripetal force pulling us forwards, right? So that essentially changes the shape of your spine. So when you lose the curve in your spine, a lot of the weight of our body shifts forwards, and over time it puts massive amount of stress and tension into the disc. And over time those discs degenerate. When they degenerate, the disc fluid impinges on those nerves, and that's when we start getting that sharp stabbing pain or that sciatic pain that's traveling into our legs, feet, toes. So if you're sitting at home and you have sciatica, you have a friend or a loved one, tag share them with this video. Chances are they sit for a living, and if they're sitting for a living, and I encourage them to watch the next set of videos. We're going to discuss good practices to improve spinal posture and talk a lot about stabilizing our core and activating our posterior chain, so essentially you can get rid of this sciatic pain without any drugs or surgery. So we'll see you on the next one.